Okay.
Okay.
This was a little bit dark.
Okay.
Okay.
Hello, Jim. My name is Carol, and I'm a nurse practitioner. I'll be your therapist today. I'm glad that you came in to see me. I know that you had signed the informed consent papers. Thank you. And what we say here is kept confidential. There's only a few situations, and that would be if you were to tell me that you were thinking of harming yourself or another, and then I would have to intervene. So what brings you in today?
6 months ago, I lost my wife. I've been lonely. I'm very lonely. Therefore, I started drinking more than usual. Sometimes I drink like 6 packs of beer. I couldn't cope anymore. I'm really, really lonely. That's why I'm here. And I was drinking because it's hard for me to fall asleep. So I was drinking so that I would be able to fall asleep, to help me sleep. So that's why I'm here. I just need help. I'm very, very lonely.
Okay. Well, I'm glad you came to see me. Your wife passed away 6 months ago. Did she pass away suddenly, or was she sick and it was?
She was sick for like almost a year.
Okay.
She passed away after almost a year. So not sudden.
So, now, was she at home when she passed away, or was she in the hospital?
Yeah, she was in the hospital because she had a cancer, so she was in the hospital. But I brought her home like a month, a month ago. She asked me to brought her home, so I brought her home. Then she passed away while she was at home with me.
Okay, so she passed out, and then she went to the hospital, and there wasn't anything else that they could do for her?
No, she had a cancer. No, they couldn't. So it was like.
Okay. All right. Now, do you have any children?
Yeah, we have one girl. Yes.
Does she live close by?
She lives in another state. But
Okay.
she calls me most of the time. We talk. But she lives in another state with her husband.
Okay. Now, you were saying you're having difficulty sleeping.
Yes.
Has that been since your wife passed away?
Yes. After she passed away.
Okay.
I've been thinking about her a lot.
Okay, so how often do you think about her, would you say, in a day?
Like within 24 hours, maybe like 16 hours.
Okay, so you're thinking about her a lot.
A lot, yeah.
Every day. Okay. Now, are you having trouble accepting that she's passed away?
Yeah, I think I'm feeling guilty. I was thinking maybe I didn't do enough for her.
Okay. So guilty. Okay. And have you been feeling guilty since she passed away?
Yeah, a little bit.
Okay.
Yeah.
Now, she had cancer. What do you think, or what are you thinking that you could have done to
At least I could have done more just to care for her more. I think I should have done more to care, to show her love to her.
Okay. Do you think that maybe you could have pursued more medication or seeing more doctors?
Yeah, at least maybe stay with her when she's in the hospital instead of coming home. Maybe I should have stayed more in the hospital with her.
Okay.
The hospital. More physical.
Now, your wife had cancer, so she knew that eventually she would pass away.
Yes, she knew.
Okay. Now, do you think she was accepting of that, or she was not accepting of it?
She did. Towards the end, she did accept it. Towards the end, she did.
Okay, so she did accept.
There was nothing the doctor could do, so she accepted it towards the end.
Okay, all right. Now, do you have any friends?
I used to, but since my wife, since a year ago, when she was really sick, I couldn't socialize with them, right? So they all left. They all like stay away. I always stay with my wife, so I couldn't socialize with a lot of them anymore. So
Okay. So do you feel like you're kind of cut off from people?
yeah.
Okay.
So
people that you were close to, you feel like you're cut off, that you're not interacting with them as much as you used to?
No, I used to be. No, I've like mostly all my friends, I cut everybody off when my wife was sick. So
okay.
Yeah.
Okay. Now, do you think, have any of those friends tried to contact you since your wife passed away?
Yeah, no, like one or two of them.
Okay.
Yeah.
And how do you feel about that?
I want to at least I want to be able to go out again, socialize again.
Okay.
Trying to get over my wife's death. So I'm trying.
Okay. So the passing of your wife and the feelings that you're having, and you feel that because of everything that you're a little more isolated, and but you would like to get back into.
Yes, I would like to.
Friends. Okay. All right. How are you doing as far as eating and your appetite?
Not that bad, but I think I drink more than eating. I think that's another problem. I drink a little too much than eating. So
okay. How much are you? What are you drinking, and how much?
Like beer. Sometimes like 6 bottles of beer, like in a day.
Okay.
Yeah.
Now, before your wife passed away, did you drink alcohol?
Like once in a while, like like usual dinner, just 1 bottle, but not that much. Before my wife passed away, even before she was sick, no, just like usual, occasional. It was occasionally drinking, but now it's really a lot.
Okay. Now, when do you think, after your wife passed away, how soon after did you notice that you were starting to drink alcohol?
Maybe like after a week, then I started noticing that I was drinking a month ago. Actually, a month ago, I realized that I was like it was getting out of hand. A month ago, I realized that. So
okay.
Decided to come today.
Okay. Now, do you feel that you use alcohol to cope?
Yes, exactly. I use that like a coping skill. That's what I was doing.
Okay. Are you using any kind of drugs like marijuana?
No, just drinking.
Okay. All right. Well, sometimes when we're grieving and we use a coping mechanism of drinking, and I'd like to help you find different coping mechanisms so that you can deal with the loss of your wife. Now, have you ever thought of hurting yourself?
No. No.
Good. Well, if you ever do, I want you to make sure that you call me right away.
Okay.
So we've been talking about you want to find a better way to cope.
Yes.
Using alcohol.
Yes.
We're going to work on that. Has your daughter noticed any changes in you?
She's not around, so she couldn't even notice if there was any changes or not.
Okay, so.
Yeah, she's not around.
Okay. Now, do you have any history of depression or anxiety in the past?
No, no, not at all.
Okay, and no bipolar disorder or anything?
No, no.
Now, with alcohol, you said you didn't drink very much before, you just drank socially before your wife passed
Yeah,
away?
yes, before.
Okay. Well, there's some things that we can work on. Sometimes after a loved one, people grieve, but sometimes some people grieve longer than others, and there's no definite time that people should grieve. It's really dependent on each person. However, when the grief starts to interfere with the person's life, then it becomes a concern. How much do you, or how do you think the grief has interfered with your life?
Yeah, like I've not been really active since the past.
Okay.
So it really affected me like a lot.
Okay.
I always on the just lay, sometimes just sit. I would just sit on my the living room for like almost 3-4 hours. Always sitting or it affected my life. I couldn't even I used to I at least go to work a little bit, work, but now I couldn't.
Okay. So you haven't been working.
Yeah, like once a while, like job that I go like maybe once a week
Okay.
just to relax. But now I've stopped after the
Okay. Would you like to go back and try to work once?
yeah yeah I really would like to go back just for me to exercise to get out of the house. Yeah.
Okay. Good. Now, what other activities did you enjoy doing before your wife passed away?
I have like I usually go to this community gathering in my area, but I stopped.
Okay, so community center, is it for seniors?
Yeah, it's for senior. Yes, in my area.
Okay. And did you have friends that also went there?
Yeah, I have. I met some friends when I was there with other with elderly people that were there, and I made some friends over there.
Okay.
But I've not been there for a while now. So
Okay. Well, that's one thing that we can work on. I'd like for you to be able to go back and enjoy some of the activities that you enjoyed in the past.
okay.
Now, as far as any kind of, do you go out and go for a walk or do any kind
Yeah.
of exercising?
Yeah, I usually walk like just take a walk around my area.
Okay.
Take a walk, sometimes a mile. That was. Mm-hmm.
Now, have you ever volunteered in the past?
Not that much.
Okay.
Not that much.
Now, when you feel better, is that something that maybe you would be interested in?
Yeah, I would like to. I would like to try at least to go to any center, sit with anybody. I would like to do that.
Yeah, a lot of older people, they may volunteer at a hospital or maybe like in a humane society, and it is a good way to interact with other people, see other people, and people usually make a lot of social contacts and friends.
Okay.
That's one thing that we can work on. There are also some groups for people who have lost a loved one.
Okay.
Groups that I can refer you to for that. I mean, I would like to continue to have you come back and we'll talk about your loss and ways that we can help you cope with that.
Okay.
Getting out and trying to be a little more social is a good way to do that.
Okay.
Now, we can talk about medication. Sometimes people experience depression and antidepressants can help. Would that be something you would be open to discussing, maybe trying?
Yeah, yeah, I can try it and see what happens.
Okay. And you said that your appetite isn't very good.
No.
Some of the antidepressants help with that, but the concern is that you're drinking about 6 bottles of beer a day. And the concern with that is that, well, there are several things. I mean, it can increase your chances of falling. Your body will become dependent on it. So it's important that you do try to gradually decrease how much you're drinking.
Okay.
Is that something that you can work on?
Yeah, exactly. I will try it.
Okay. Because you've been drinking a 6-pack every day, and a 6-pack every day, how many weeks would you say, or months, have you been doing that every night?
For almost 3 months.
Okay. So with that, there's concern that you may go through alcohol withdrawal.
Yeah.
You can have seizures and hallucinations. So it is something that has to be done gradually. So try to decrease to 4 beers, and then in several days go to 3, then several days go to 2. I really would like for you to decrease the amount. I know that right now it's helping you cope and it's helping you sleep, but I can give you medication. There's a medication called Remeron, which actually helps with sleep, and it also increases your appetite. And drinking will decrease your appetite also, and it's important that you watch your diet. Now, do you take vitamins, like a multivitamin?
Yeah, with my once in a while. The doctor.
Okay.
Yeah.
I'd like for you to do that. And then as far as therapy, there's a therapy called cognitive behavioral therapy, and it works with your thought process, and we can work on that, and we can do some cognitive behavioral therapy, and we can start some medication, and I'll refer you to a group for people who have lost a loved one. Does that sound like something you'd be willing to, a plan you're willing to?
I will try.
Now, after therapy, what would you like to accomplish with coming to therapy?
What I'm trying to achieve is to cope, to improve my coping skill.
Okay.
I want to stop drinking, and I want to sleep. So if I can achieve a coping skill that can help me to relax more, and also for me to be able to sleep, that would be really nice.
Okay. So we're going to work on that. We're going to have you work on decreasing the amount of alcohol that you're drinking. Continue to walk and to get exercise. And so we'll work on all of those together. And I'll give you some medication, as I said, that will help you sleep.
Okay.
And it will also increase your appetite.
Okay.
And then we'll continue with therapy. Okay, well, I would like to see you again in a few days.
Okay.
And we'll continue with therapy. Okay?
Thank you. Thank you very much.
Thank you.
Okay.
Okay.
Wow, okay. That's a lot. That was good.
Wow. Thanks.
Okay. Let's go to bullshit. Okay. So, how are you today? So, my name is Margaret. I'm going to be your therapist tonight. I know you've already signed a contract with my secretary outside. So that is giving me the right to treat you, to talk to you. And also, also letting you know that this section will be confidential. It's just between me and you. Anytime I have to disclose anything will be if you tell me that you're going to harm yourself or harm anybody, then I have to like discuss whatever we discuss. But apart from that, it's going to be confidential, just between me and you. So is okay?
Okay.
Okay. So, so can you tell me why you are here tonight?
Yes, I lost my wife about 6 months ago, and I think about her all the time, and I wish she were here with me, and I guess I'm just not coping with it very well. I've been drinking more than I have in the past, and I've been kind of isolating myself, and my children are concerned and just wanted me to come and see some.
Okay. So, you say your wife passed away 6 months ago.
Yes.
So, since that 6 months ago, or what are you using for coping? How have you been coping with her death?
Well, um, I guess I really haven't been. I have a hard time sleeping because, I go to bed and I just think about her more, and, of course, things remind me of her. Like I still have her clothes in the closet, and a lot of her personal items, and so just to get to sleep, sometimes I drink to help me go to bed.
Oh, you drink. So you are using the drinking as a coping skill. So
Well,
is that okay? So like how many bottles? What are you like? What kind of drink? Like a month? How much?
well, I never really. Before I would maybe drink a beer like once or twice a month, but I noticed that I've been like buying like a 6-pack of beer like every day, and I've been drinking that.
Okay. So and your kids? Do you have any children?
I have 3 children, 2 boys and a girl.
So where are they? Are they near you? Are they close to you?
Um, my daughter, she lives fairly close, about 15, 20 minutes away. My one son is about an hour away, and my second son lives out of state.
So your kids that live near you, is she like close to you at all? Is she coming over to check on you?
She does. She comes over, and then I go over there, every Sunday for dinner. She works, has her own children, so she's kind of busy, but she calls me frequently.
Okay. So before your passed away, are you really close to your wife before she passed away?
Yeah, we were married for about 55 years.
Oh, okay. And you are very close to each other.
Yes, I'm sorry. We were married for about 45 years.
Okay, and you were close, very close
Yes, we did everything together.
together.
Yeah, we used to do a lot of things together.
So her death, was it a sudden death or has she the
Well, she had heart failure, so she the last couple of years she wasn't able to travel as much, because we would travel like 3 or 4 times a year, but she wasn't able to travel as much. And the last 6 months, the doctor said that, there really wasn't any more that they could do. And they told her that, she only had about 6 months
okay.
left.
So within that 6 months that was left, what were you close to her? Were you there for her?
Yes, I helped take care of her. I would make her meals, and she needed help bathing. I helped in dressing, and like the last month, she was on hospice at home, and of course I was there all the time.
Okay. So You say you've been thinking about her. So are you feeling guilty, or why is it hard for you to sleep?
Well, I lay down, I close my eyes, and I see her. I picture, I have images of her in my mind, and it's just, I guess maybe I have a little bit of guilt. I always thought that I would go before her. Men usually don't live as long. Um, yeah, I think I do have some guilt.
Okay. Okay. So because of the guilt, what are you what are you trying to do to stop thinking? What's your rationale for the guilt? You understand my question?
So what do I want to do about the guilt? Or
Exactly. What do you think you can do?
well, I mean, I didn't cause her to have heart failure. I know that. And I know that really probably there wasn't anything else that I could do. And
Yes.
I think I need to accept that, yes, I did everything I could.
Exactly.
And I couldn't do anymore, but I have to accept that.
Okay, that's what I really want you to understand, that there's nothing you can do to help her to stop her death. So I'm just trying to pull you away from your guilt for you to be able to realize that death is not your fault. You understand what I'm trying to tell you? Okay.
Yes.
Okay. So before after, do you have like any coping skill apart from drinking?
Well, um, I'm really good at chess, and I used to go to the senior center, and I have some friends there. But the past 6 months, my wife was really bad, and I haven't, you know, I wasn't able to do that for about 6 months before she passed away, and I just never. I just don't feel like going and being around people right now. I know I'm isolating myself. I just don't feel like being social.
Do you think you can try and go back, even if it's like once a week for now,
Um,
just for you to relax yourself?
well, yeah, I can. I'm gonna have to push myself to do it, but
Exactly. Let's start with once a week.
yeah, I can. I can try to do that.
So, do you have friends?
I do, but I haven't really been keeping in touch with them, especially, since my wife passed away.
You think you can at least maybe one of them you can get in contact with them? You
Um,
can invite one or two to go out. You think you can do that?
yeah, I really, people have been calling me, but I just haven't really been returning their calls. And
So you want to try at least one or two of the calls?
I can try. Yeah, I should do that.
Okay. So we start from there. Just try and go and play chess. Then maybe try and return your one or two of your friends' call.
Okay.
So we try and do that. Also, uh, another. Do you do drugs? Do you think you could do drugs? Have you been doing drugs?
No.
Because some people can use drugs for sleep. Not been doing that. Okay. Are you thinking about harming yourself or do?
No.
Okay.
No.
Then also, you say you've been drinking like almost 6 packs of beer to help you sleep. Okay.
Yes.
Okay. I want you to, if you can try and be reducing your beer, drinking beer, like maybe one bottle at a time.
Okay.
I don't want you to stop drinking at once. You can into alcohol like withdrawal. So that will cause of issue since you are home. You can have seizures. You can have so. for you, so for you not to have withdrawal, you can stop drinking. You can start maybe tomorrow. You can drink maybe 5.
Okay.
The next 2-3 days, 4.
Okay.
So let's stop like little by little, not at once. You can't stop at once, but you can stop it, like reduce it little by little.
Okay.
Or prescribe a medication that you can take that will help you to sleep. Have you ever tried any medication for sleep before?
Sometimes Tylenol PM, I think it has like Benadryl in it.
Does it work?
Um, Sometimes it works, but I haven't taken it, a lot lately because I've been drinking, and I'm just concerned that, the alcohol and the Benadryl together might be too strong.
Too strong, exactly. Too strong, too strong. So when you stop drinking, then we'll look for the medication that will sleep. So, are you depressed?
Yeah, I think so. I just don't really feel like going out and doing anything. And, I know I've been thinking about my wife for a really long time. And, my daughter, was concerned that I'm staying in the house and I'm not going out.
So,
She wanted me to come and talk to someone.
okay. So, do you have history of depression or?
In the past, no.
No. Okay. So you've never taken any antidepressant before?
No.
Okay. So I can also prescribe you, like, started from the low dose of antidepressant. It can also help you with your mood. And also, there's a program, like a group, that people, there's a like a community group that people with that lost their wives or their husband, they usually go. It's like a group
Okay.
program that people goes there to talk. Everybody discuss, like a discussion. Everybody talk about risks, like whatever they discuss can help you. So I will also like you to go look for like a community group in your area.
Okay.
I also refer you to some of the community group that you can attend. So for you to go, you sit with other people and discuss. So you can try that.
Okay. I can do that.
Yeah. Also, drinking, there is a program they call AA. So it's like a group too of people drinking. So everybody sits, discuss about what's the cause of the drinking, what they think they can do to help each other. You can also attend one of those meeting. They call the AA meeting. I also attend one of those. You think you can do that?
I can think about it.
Yeah, you can try, and even if it's once a week, twice a week, you see that it's a lot of people are going through what you are going through. I just want you to know that you are not the one. A lot of people are going through the same problem. A lot of people lost the loved ones that they are going through uh, your condition. So you are not the only one. So I really like you to reach out. It's a lot of program in your community that can help you. So I don't want you to try and go out. You think you can do that?
Okay.
Yeah. So I also refer you to some other program that you can attend that will really help you with it.
Okay.
Okay. So so what do you think go? What do you think you really want to achieve from this section? What's your goal?
I think eventually I'd like to, basically just, go on with my life. And, I love my wife, and I know that, thinking about her constantly all the time isn't good.
Mhm.
I'd like to, I'm not going to forget her, but I'd like to be able to go back out and, you know, do more social things and be
Okay.
involved.
Okay. So, and since that's your goal, I would like us to start working on it, on that goal, so that you can achieve your goals.
Okay.
Okay. So, starting from tomorrow, at least you can walk around your area and see if you can find any group, any meeting in your area. I'll also help you to like search for some and give you some location that you can also go before end of this section. Is that okay?
Okay.
Okay. Did you walk around at all like a exercise? Did you do any exercise?
Exercise. I mean, you know, I like to ride my bike, but I haven't been doing it.
Yeah, that's even not. You know, in hospital or especially in nursing home, there's a program that like elderly people like you can go and just sit by the other people in nursing home. You can read them. You can just sit by them and discuss to keep them. You can also do that. You think you can try that once in a while.
Okay.
Yeah. So just for you to get out of the house, take a walk, to get a good fresh air. That's another good way of coping.
Okay. Yeah,
Okay.
I can do that.
You can do that. Okay, that would be good. So by next week, I want you to at least attend one of those meetings,
Okay.
or also even to go to the any like nursing home. It's like voluntary work, so you can also go there at least once before you come back. I would like to see you next week.
Okay.
So by next week, so I want to achieve one, attend one meeting, and also see if you can find any of the nursing home, you can do a voluntary work. You think that
Okay. Okay, I can do that.
okay, so by next week, I want you to achieve that. You'll be able to do that.
Okay.
Okay, that's good. So I would like to see you back next.
Okay, I'll come back.
Okay then. Okay, so have a good week.
Okay. All right, I'm gonna stop. Let's see.